Creating an agenda is a collective approach in which the psychotherapist and the customer select how the meeting time will be allocated. The patient and therapist make a list of topics they would like to address and then decide on the order in which they will discuss them and how much time they will spend on each. Setting itinerary guarantees that the session's time is utilized correctly and that both the psychotherapist and the client have an influence on the topic. CBT can be a powerful technique in the treatment of mental health illnesses like depression, PTSD, and eating disorders, whether used alone or in conjunction with other methods. However, not everyone who benefits from CBT has a psychiatric disorder. CBT can be a valuable technique for anyone who wants to learn how to handle stressful events in their lives effectively. The videos provided show 2 sessions with patients, however, they are structured slightly differently. In the first video, the counselor guided the patient through a conversation and a whiteboard graphic, where he briefly wrote down how the patient was feeling. In the second video, the process was more straightforward. The counselor communicated with the woman, and he summarized the essential points for himself. As in the first and the second video, the patients were not always sure of their answers. However, they were assisted by their counselors with leading and innocuous questions that could give a complete account of what was happening. In my opinion, the style of counseling with graphic support is more effective since the patient can also observe what is happening with his own eyes, which gives confidence that there will be a result. A homework review is an essential aspect of a CBT therapy session. If counselors do not go through assigned assignments, it sends the idea that it is not crucial. They will also look at how far the client has progressed with the tasks they set for themselves the last time. They will plan additional assignments to undertake outside of the meetings, such as homework, at the start of the evening. For instance, the therapist may encourage the client to keep a journal of any situations that cause anxiety or despair at the beginning of therapy so that they can analyze their ideas around the event. Usually, new counselors face typical problems when working with patients. Firstly, some individuals never add anything to the schedule from the previous week's activities or their homework. Some clients discover in subsequent sessions that most of what they would like to talk about comes up when they review their assignments, and they are not overly anxious during the week. It is self-evident that there is no need to add a plan in this scenario. While the client usually just does not have anything to express about what they want to talk about, there is also the possibility that they are holding back because they are ashamed of their pain or issues. In such cases, it is necessary to talk to the patient in order to get closer and let him know that he is safe. A frequent second issue is when the customer presents too much to the table when it comes to agenda setting. In this scenario, the counselor should create a long list of possible topics and supporting elements on the whiteboard and then ask the person to select which 1 or 2 they need to focus on in this meeting. It is preferable to thoroughly cover a small number of subjects than to skim over an enormous variety of topics. Another issue is becoming sidetracked from the main topic. Although I am aware that the CTSR recommends it, I do not commit time to each agenda item. It feels a little forced to me, however, I do use it occasionally with extremely verbose clients with an educational rather than a punishing goal. Having said that, I fully acknowledge running late rather than ahead of schedule. I try not to book a client on the hour, every hour, as a pragmatist and because I have some flexibility in private practice. Including some catch-up time in the schedule is a practical method to correct for ravaging and to look after the patient. Developing an agenda is a collaborative process in which the psychotherapist and the client decide how the session time will be divided. The therapist and client make a list of subjects they would want to cover, then agree on the order in which they will talk about them and how much time they will spend on each. 2 meetings with clients are shown in the movies, but they have been arranged in slightly different ways. In my opinion, therapy with graphic assistance is more helpful since the client can see what is going on with his own eyes, giving him confidence that a result will be achieved. As a pragmatic, and since I have some discretion in my practice, I strive not to appoint a customer on the hour, every hour. Including some grab time in your calendar is a sensible way to compensate for the ravages of time and to care for me. StudyCorgi.com has everything you need for successful studies. Writing tools, informative articles, and essay samples. Come check it out!